Good evening, and welcome to The Caring View, the online health and social care platform free to access to absolutely everybody. Before we get started, don't forget to hit that like, hit that subscribe, give us a follow on whatever platform you are watching us on tonight. www.thecaringview.co.uk for all of our episodes, free resources, and all of our free shenanigans. Please do go check out the website, and don't forget to pose your questions or give us your feedback throughout the night, and I'm sure we will try to address it. We are free. We are always free. We are never going to charge you. And the reason we are free is because we have some absolutely fabulous sponsors who keep the lights running here at The Caring View. So without further ado, I'm going to give a quick roll call before we get into tonight's show. So we have Prosperwell, the UK's leading digital marketing agency, www.prosperwell.co.uk. We have got CBAT, Care Business Associates training, for all of your healthcare training and requirements. CBAT can provide every training course that you need, be that clinical, be that social care, be that high performance leadership, train the trainer, you name it, they have got it. We have got Attis Care by Attis Insurance Brokers for all of your comprehensive care, coverage, and proactive risk management. James Bergen is also a helpful voice on the other end of the line. We've got Log My Care, the intuitive care management platform loved by complex care providers. They also have a freemium version of their software as well, so you can try before you buy. Health Automated and Enlearnment Online, AI-powered software. Mark, might just need to check our LinkedIn because I think we've gone down again. Health Automated and Enlearnment Online, AI-powered softwares, AI-powered care planning, AI-powered training. And we have got Florence directly connecting healthcare professionals. Oh, I've not pulled them up. Florence directly connecting healthcare professionals with healthcare professionals and organizations with shifts and training around the country. Great alternative to agency, and also another really cool learning platform as well. And last but not least, we have Every Step Care Consultancy, transforming care services with tailored consultancy, turnaround management, coaching, and compliance support. If you've missed any of those, watch the episode back or go to our website, www.thecaringview.co.uk. It's under our names, and you can find out all about our sponsors there. Good evening, Mark. Good evening, everyone watching. If you are watching, let us know in the chat if you can see us live. We had this issue last week where my go live buttons come back to make it look like we're not live. And apparently we were live last week, but we had some issues with LinkedIn. So please do let us know in the chat if we are live. Mark, good evening. How are you?
Yes, good evening. Not too bad. Well, we are live on Facebook, we are live on Twitch, and we are live on YouTube, but LinkedIn appears not to be live. So, yeah. I don't know. Last week was a funny one because I obviously had the end stream button on my side of things last week, which we don't normally have. And then when I was setting up the show, it was like, you've been live for 146 hours. And I was like, well, I swear I ended it. Have we actually been broadcasting? I thought to myself, well, I might have been broadcasting myself for a whole week without knowing, but I have no idea what happened last week.
Yeah, very bizarre last week. Very bizarre. How are you though, Mark? Good?
Yeah, not too bad. Not too bad. It's been a busy week. It only feels like it was yesterday when we were live last week discussing the CQC consultation. How are you?
I'm good. It's gone really, really fast. I think this time of year does go fast. It's not a slow time of the year. It sort of speeds up now, and then maybe that's our age now. Maybe it's just because we're getting older, things speed up. You mentioned the CQC consultation. Just to remind everybody that it is open. It's not in our comment section, but just to remind you that the CQC consultation is still live. I want to say until the 11th of December. So get your thoughts, get your comments in on there. It's a lengthy consultation, so really worth giving your two penneth. Many things they're proposing to change or revert back, depending on which way you look at it, but will be really beneficial if you do give us or give them your feedback. No, I'm good. I feel like it's weird not having guests tonight, and it's weird thinking about, right, well, let's talk about what's going on in social care, because there's always something going on in social care, but we don't tend to really talk about it. And there's a number of things. There's two massive consultations at the moment, isn't there? We've got the CQC consultation, again, like I say, open until the 11th of December. Correct me if I'm wrong there. But then we also have the fair pay consultation, which I want to say is open until the 16th of January. But again, correct me if I'm wrong there. totally worth giving your two penneth for both of them, and not just for managers. This is for anyone, for both consultations. People who use your services, relatives of people who use your services, people who work with you, people who work separately, people who are unpaid carers, people who are paid carers but private. Anyone who has got anything to do with social care, really do push these consultations, because again, what we don't know, they can't do anything about. And we want to let them know as much as possible, don't we? So get those consultations filled. We will try and get those comments, or get it in the comments tonight, where you can find those consultations. Not going to lie, though, I'm struggling. I went to the walk-in centre last night thinking I broke my thumb, and it is still swollen. They think I've got tendonitis, which is crazy. I feel like I'm falling apart now. I feel like I've never been to the hospital or the doctors for years, and I've been like too many times this year. I'm not enjoying it at all. I know I'm preaching to the choir here, Mark, but
I was going to say, you can give me a run for the money. Yeah. Well, that's how I started. You know, I'd like never ever used the NHS, and I swear I've probably used it with the majority of the population over the last how many years. So yeah.
So Mark, where are we starting tonight?
Yes. With tonight, we're going to start at the Skills for Care State of Care report. I just wanted to say, with the Fair Pay Agreement, I was at a care association in Essex, and they had people from the Department of Health and Social Care. There is an email address that they said that they are checking every single email. There was a lot of confusion around home care, obviously, with the introduction of 0 hour, or they want to get rid of 0 hour workers. They didn't seem to understand home care and how that operated at all. And they were really welcoming feedback from home care providers. So if you're a home care provider listening tonight, make sure you go and check out that consultation, and do contact them with your concerns. But yes.
I feel like that 0 hour conversation has been going on for years. It was going on when I was in home care.
It has. And I don't know, like the conversation around the table I was on is, will people just move away from 0 hours and just offer people, you know, like a 1 hour contract or a 6 hour contract, or, you know, you just actually pushing it along? But we shall see. Or everybody was like, well, we'll just offer people, instead of 0 hours, just put everybody on a bank contract, and then you get around it that way. So I do feel like they're going to try and get rid of one problem, and it'll just rename itself or be something else somewhere down the line, but we shall see what comes of it.
But I mean, just coupling it with that, we've got all these employment law changes which we're expecting to come into play next year as well, haven't we? You know, about the firing, rehiring, sick pay from day one, extending that sort of probationary period, but giving people employment rights from day one. So there's going to be a lot of changes coming around. I feel quite quickly over the next sort of 12, 24 months.
Yeah, it'll be interesting times to kind of see. I think there'll be a lot of providers that struggle through that, especially the small ones.
Yeah. Sorry, Mark, you were saying State of Care report.
State of Care report. Yeah. So last month, just over a month ago, Skills for Care published its annual State of Care report, as they always do every year. I don't think there was much in it that I was kind of surprised with. But if I kind of go through the key findings, so they were saying that social care contributed 77.8 billion to the economy, which was a 12.2% increase from last year. Total posts grew by 2.2%, with 1.71 million roles in total. 1.6 million of those are filled. Growth was driven by more filled posts and higher pay following the national living wage increase last year. Vacancy rates fell to 7%, which is pre-COVID levels, which is good news. And turnover as a whole dropped slightly, so sits at 24%, or 24.7%, which is quite worrying. It's something that we should pick up in a second. International recruitment has slowed down sharply, so 50,000 recruits compared to 105,000 last year. Again, something that as a sector, probably, I know there were a lot of changes around international recruitment and bits and pieces, but I know there's a lot of organisations that rely on them. Men now make up 22% of the workforce, which is a record high. So great to see more men coming into the sector. Definitely what I'm seeing in the London boroughs, we've got more men than we do females joining joining our services. Vacancy rates remain 3 times higher than the wider economy. Qualification levels are falling, so only 38% of care workers hold a level 2 qualification now, which is down 41% from last year. And still benefits lag employees, so 62% of employers don't offer enhanced sick pay, 57% don't offer enhanced pension contributions. So obviously when we're comparing that to other sectors, trying to attract and retain the workforce, obviously vital things. And obviously I'll just finish it on the projected need of roles. It's currently sat at 470,000 new posts by 2040 to meet rising demand. So still plenty of roles for all the men and women out there. Yeah, Adam, what are your initial thoughts?
Can I be honest?
Yeah, Dom, as always.
It's just another report, isn't it? Like I get it. Like I do. I totally get it. And I suppose if governments start listening to these things, then yeah, it benefits. But actually, I don't really care about how much social care is fed into the economy. I couldn't give two hoots. I want to know, how are we doing? What's our turnover? What are the biggest issues? And when you look at that, so just to caveat all of this, this is only based on information that's provided to Skills for Care from people who complete the AskWDS, period. Yeah. So like you need to complete the AskWDS to give them this feedback, and then they will just extrapolate this and sort of project it for the rest of the country. So if you don't complete your AskWDS, they're not getting that data. But they've got 5 factors that they've identified for reducing turnover, right? And if teaching to suck eggs was ever a report finding, I feel like this is it. So competitive pay, groundbreaking. No 0 hours contracts. Access to training. I mean, we're on to a winner here. Relevant qualifications. Full-time work. Okay, so everything we always strive to give anyway. I mean, yeah, there's providers out there giving 0 hour contracts, and we just discussed that briefly. It's wrong, it sucks. But I think what we miss on that conversation is actually there are a lot of people out there who like 0 hour contracts. Like they want to be on a 0 hour contract. I want to be on a 0 hour contract because I can choose and pick my hours. I've got children, I've got this, I've got commitments. I'm also a home carer, I'm a private carer. I don't want to be bound to contracts. Some weeks I can do more, some weeks I can do less. That brings me joy. It's great. That's what I want to do. So I think the conversation about banning 0 hour contracts is a lengthy one, and one for a totally different show, because I don't think it's ever going to be possible. I don't think it'll be truly possible, because I think the minute you ban 0 hour contracts to reduce turnover, as the Skills for Care report says, we're then going to ostracize a ton of people who actually rely on 0 hour contracts to work and fit it around their daily life. Yes, we could turn around and go, well, providers need to be more flexible. Cute. But we can't always be super flexible. And how do we then accommodate that for people who are on contracted hours? Because the minute you do it for everyone on contracted hours, for people on contracted hours, you got to do it for everyone, which is why 0 hour contracts benefit those who aren't on contracted hours. Yeah, they don't get the same benefits of people potentially who are on contracted hours, but we've changed the holiday laws now, annual leave laws. So it's all, I don't know, it's all very muddy. I just think, I don't know. The projection of 4,700 workers by 2040, again, is not a new number. We were saying 500,000 by 2035 a few years ago. So it's not really changed that much. Recruitment from abroad is reduced. Yeah, no shit, Sherlock. They've put bans on what we can and who we can and who we can't recruit from abroad. So of course that's going to reduce. And the minute everyone started doing it and realizing how difficult it was, we're still a panorama episode away from a huge break in social care with the misuse and the mistreatment of people coming into this country to work. So I don't know. I want to love it, but I don't. I'm not getting what I need. I don't know whether I need it. I don't know if it's not, I don't know. I'm not getting what I need from it. I just don't know whether I need it, if that makes sense. And I've had this bug about Skills for Care for a while now, that they get so much money as a Quango. They get so much funding. Yeah, I know they're a charity, blah, 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 blah. But the name is in the title, Skills for Care. And I feel like they're just another body that just reports and just creates top dog jobs does loads of reporting and webinars, and I just don't know what we get for the money from that. Yeah, if you subscribe to them, you get a manager's guidebook or something. Fine, great, but actually, I want more from Skills for Care than an annual report. I just, I don't know. I really struggle with it, Mark. I really, really struggle with it. I mean, you get the provider forums, you get the registered manager networks, and all of that. But again, apart from being a place in which you can go and talk to other managers, I've never really heard anyone say, "Oh my god, it was amazing what I got from this network." And I'm not poo-pooing them. I think that so much great work goes on. We've got some lovely contacts at Skills for Care, and I think they're amazing. And I've done podcasts with them. I did the Care Exchange podcast, loved it, great experience. I've got friends who work for Skills for Care, love them, great people. I don't know. Every time this report comes out, it just takes me back to my IHSCM days where I was writing reports and I was thinking to myself, ain't no one going to read these. Like I literally had them in Parliament and ain't no one going to read them. I still want people to do their SWDS, but I feel like that drive has sort of dwindled since the Workforce Development Fund was taken away and it's been pushed over to the NHS Business Authorities, LDSS. People don't fully get that. So people don't understand about completing the SWDS data set. I tried to benchmark one of my homes in a location around this country. And I think it came back that it said like 9 providers in the area had completed their SWDS this year. And I was like, I know for a fact there's 200 plus providers in this area. And I can't even benchmark myself against the data because people aren't putting it in. And I don't know. That just makes me wonder how accurate it actually is. I'd love to see a breakdown of this data. It might be in the report. I don't know. I've not sat there and read it cover to cover. It might be in the report, but I'd love to see a breakdown of where the majority of responses came from, because I'd want to see if there's any sort of postcode bias within this as well. So if the majority of them came from like London districts, or if the majority of them came from northern districts, it'd just be interesting to see what proportion of data came from what part of the country. Because I know recruitment is incredibly hard at the moment. I know recruitment across the board is incredibly hard at the moment. I know home care recruitment is especially hard at the moment because ain't no one can afford to drive. People don't want to have to pay to work. So I don't know. Does it go into granulars, the report, or is this basically the sort of top level stuff? Does it go into like home care vacancies and stuff?
Yeah, you can. So I'm on their website now. So that's obviously just the high level. There is then you can explore the data, so you can dive straight into it. So you can see kind of, and then it obviously benchmarks 2023, 24 against 24 and 25. But yeah, you can then dive into your own regions,
Cool.
the demographics, the pay to then benchmark. In the pay, you can then break it down in between all the way from a care worker role, senior care worker, social worker, registered nurse, OT, all the way up to kind of senior management level. Let's see. Recruitment and retention. Yeah, you can break it down. Care home with nursing, care home only, non-residential nursing. And then whether they're independent or local authority. So yeah, you can break it down. You obviously have the time to be able to sit there and go through each bit to have a look. I mean, you can download it into a
PowerPoint.
Can't download the whole thing. You can only do specific sheets from this workbook. Whether you can do the whole lot, I don't know. I don't do it. I'll probably crash my computer and you'll lose me. It was interesting regarding the WDF though, because as you were talking, I did wonder to myself whether we also had that funding change. I don't know what, because I don't do the RSWDS. It's done by our quality lead. But I remember it being a bit laborious, and I don't know whether it's still like that, and whether people now just skip that training section, which is why we've seen such a reduction in qualifications. I mean, we also had the whole, which was always around, but I think there was people bypassing it in terms of the study time. I think now apprenticeships, they're on it, checking that study time. And I know I've got staff in my teams. We've got a waiting list because we've got so many people doing them. It's near on, you would never be covering the rotas if everybody was doing a qualification.
But don't forget as well, though, that apprenticeships can't be funded by the LDSS, so there's less people taking up the apprenticeship role because they don't get the funding for it. So there's those to take into consideration.
I think the only other thing for me is around that 470,000 mark. Like, what was it by 2020, 2040? I just think technology is moving so fast. And I think we only have to look across, to China and Japan with their robotics and the care that they're delivering. And they've managed to reduce most double handed care down to single handed, a lot of the single handed off to robots. And I'm not saying that we should just replace everybody with a robot because we shouldn't, but I do think there's a place for tech. So actually, will we really need that many roles? I don't know. Part of me wonders actually we probably don't need half of those roles by 2040 if people are. I think our like me and you, our generation. I even think like my parents' generation will all accept a lot more tech and digital products to support them.
I know what you're saying, and I think we do need to. Obviously, there's the fear of that. Thank you, James Cameron and Terminator. We fear the uprising of machines, but I don't know. I always think like we get the conversation the wrong way around, because it's always like, right, more funding, more carers, more funding, more carers, more funding, more carers, when actually more conversation needs to happen around preventative. So let's start young. Let's change health habits. Let's get people on the right track. Let's prevent these poor health crises moving forwards. The NHS say they're doing it, and you see the posters up in places, and I get all of that and what have you. But I know the government don't take it seriously, because every other advert is either a gambling advert or an alcohol advert. And I've only really noticed that since watching Four on Demand to catch up on some shows, and every other advert comes up bloody alcohol or gambling. And if we cared that much about society and becoming a healthier society, we'd sort of put a stop to all of that. We did it with smoking. We did it with smoking. In fact, we've probably got more data to prove how deadly alcohol is in comparison to smoking. And alcohol is not just deadly to your liver and everything else. You've got corticoffs, onsets with that. You've got everything else that comes along health and body wise, but then you also have the violence in homes that come from it as well. So there's so much to take into consideration. And I'm not just saying that as a sober person, but there's so much to take into consideration around why society is how it is, that fixing social care or fixing the recruitment crisis isn't for me necessarily just about recruiting a ton of people, because we're projecting 10 years in the future. Why don't we project, 15 years in the future? Why can't we project 15 years in the future with a healthier society, which is what we need to be doing? We need to be looking at how we can make society healthier and promote healthier choices, get rid of these. I had a bit of a rant to the guy at Morrison's, the manager, because I walked through the door and everything is chocolate, crisps, cakes, chocolate, crisps, cakes. And I was like, you do realize like new restrictions came into play about advertising and selling high fat, high sugar products at the till and at the entrance of your building. And it was basically a case of, well, yeah, we get fined less than we do, then we make money. And I'm like, well, that's ridiculous. It's like there has to be a commitment to making a healthier society. We can't just put the onus straight onto social care. Otherwise, we are going to struggle. And then, like you say, we need to have a look at different ways of working now, because current model doesn't work. What we're seeing is providers actually trying to take away benefits because they can't afford them anymore. The national living wage increase was higher than expected, and the real living wage was even higher than expected this year. God knows where we're going to be in 2, 3, 4, 15 years' time when we get to 2040. I just feel like we're on this sort of Sisyphean cycle of never-ending chasing the final dream, which is never going to come unless, like we've spoken about for years, Mark, we turn around and go, right, there's a national minimum care wage which everyone has to pay, and great, that'll be wonderful. But then how do you keep up with that? How do you keep up with the differentials? You've got ICBs that are going bust. You've got councils that are going bust. Providers aren't getting the funds through that they need to get through. People don't want to pay high levels for care. I think that idea of luxury care homes is sort of dwindling already, because the affluent part of society is just not that affluent. I mean, bring them to Blackpool, and I'm not being judgmental here, but we are not an affluent place. We are a very poverty-heavy place. The amount of times I see people in the supermarkets on their phones at the till checking their bank balance before they go and purchase their groceries is scary. Like, it's terrifying that people can't afford to live. And yet we want to pump more money and to pay people more, but we're not getting that money through. It's gone beyond, for me, the ideals of fixing social care and more a wider society issue, which no one really wants to discuss, because no one wants to discuss the fact that NHS have all these wonderful benefits of pensions and sick pay and all that crap that comes along with working in a public body sector. And where does that money come from? National insurance, from tax. It comes from us, the people who don't get those benefits, and we're paying for the benefits of the health system. Get rid of those benefits, free up a load of money for the NHS, Bob's your uncle. Same with all the other public sector bodies. Yeah, I get it's nice having a lovely pension and being able to retire at 55 and then go back into another job and still draw your pension and get another wage. But actually, it's damaging to society when everyone else can't do that. And that's not me sulking because I don't have that. That's me saying, if we're going to talk about actually fixing stuff, let's make things, let's just bring some parity. Let's just get rid of all this bureaucratic rubbish and start putting money where money matters instead of in a select few. I don't know. Maybe I'm an idealist, Mark. Maybe I'm living in this sort of utopian fantasy, but I just don't think we're getting things right. And there's no way. I struggle when you watch there was a new. I don't read the news. I don't do anything like that. I've got Twitter, or X, whatever it is, but I don't go on it. But it still sends me notifications. And a pop up came up the other day. Alan Shearer said they paid too much money for such and such a player or something like that. And you get everybody going, "Oh my god, yeah, I can't believe they spent that much money. I'd have paid less for him." Blah blah blah. I'm sat there thinking, 100 million for a guy to kick a ball around on a field. Are you winding me up? Are you? We're living in this sort of Hunger Games bizarro world where we put people on pedestals, give them millions and millions and millions and millions of pounds, and watch society starve. I don't get it. I don't get it. And I get the state of care report. I get the stuff that the government talk about. I get what everyone else talks about. But actually, we have a larger issue within society. It's a cancer eating away at society that no one wants to tackle. No one wants to address. No one wants to sit there and go, do you know what? Politicians, shut your fucking mouths. Stop hurling abuse at each other in parliament and everything like that. Just sit down like normal people and let's get this sorted. Let's just act like grown-ups, think of the people, and let's get this working. But no, everything's got to be a competition. Everything's got to be a challenge. Everything's got to be a side. Everything's got to be a label. And I don't think any report or any conversation is ever going to get us to where we need to be, because I think as a society, we're just not doing what we need to do until we get round to the next general election and social care becomes a manifesto dream again, so that they'll whack us in there and pretend that they're going to fix everything, get elected, and then do bugger all when they're in power. That's what I think of the state of care report.
I do think we need an overhaul of what social care looks like. I've had obviously where I'm not driving, I'm getting many Ubers, but there has been a couple of the Uber drivers that have come from the NHS or from social care, and they were just talking about the flexibility in terms of a work life and being able to choose their hours. And it did get me thinking while I was in the Uber the other day talking to one of them, and he was saying he basically gets in his car, he turns on his Uber app, and it's like pinging him where there's jobs. So he does a local one, then he goes home, picks up his kids, takes them to school, obviously comes off the app, goes back home, has a coffee, turns it back on, pings. So basically every time he wants to work, he just turns it on, and there's obviously all this demand, and then turns it off when he doesn't want to work. And he was like, there's no expectation to work. It's not like working for a taxi company where they're ringing you the whole time, and if you decline a number of visits and they strike you off, you're literally like, you're on the app if you want to work. You don't go on the app if you don't want to work. Like, you can work for a week, then you can have like 3 months off. You can do really whatever you want. And it did get me thinking about whether, if you had loads of, obviously you would know all the customer, client, people that we support, visits that they need. And I did wonder whether if you had it different, if you had enough carers that were just kind of pinging their apps on and off, whether or not it would cover all the visits you need. You'd obviously have to have a large amount of them. But I do feel if you were a large organisation, it's probably quite doable.
And I suppose that, yeah, I totally agree. And I suppose, well, I mean, I do totally agree. But then you get the whole person-centered care, continuity, blah, 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 which I'm not poo-pooing, 100% needed. But I do just think there is other models now that we need to be looking into. We are all stuck in these rigid 8 till 8s, 2 till 8, 8 till 2s, breakfast, lunch, dinner, activities in the morning, activities in the afternoon. I just don't think the model works. But then also, I feel like it doesn't help that there is such high demand and high expectations on people now in providing care to provide absolutely outstanding, keeping up with the Joneses stuff, where most people are just thinking to themselves each day, God, I just hope we can get everyone up. God, I hope we can just make sure everyone's had the medication. God, I just hope we can give them something to eat today, something to drink today. And that's not because they don't want to provide good care. That's because they just can't get the people through the door because people don't want to come and work, which then brings us round to flexibility, pay, and all those other issues. I've never met anybody who's gone, oh no, I don't want to work in social care. I'll put you through your level 3. Oh, you've twisted my arm. I can't wait. Never met that person. Like I've never met that person. I've never met a person who's gone, oh, I'll only come and work for you if you're full time. Because actually, pretty much every organization, every business will offer full time hours. So I don't know. Enhanced pay again, great. We'd all love to do it. We'd all love to offer everyone enhanced pay. How do you afford that? So I feel like they're saying these are the 5 things to prevent your to reduce your turnover. You're just not going to be able to do them. You're just not going to be able to achieve it.
I don't know whether full time is actually what people. I mean, we offer everything from bank. But the lowest contract is 6 hours and 12. It goes up in 6-hour increments all the way to 36. And then if people want more than 36, they can pick it up as overtime. But in the Essex region I oversee, I think the average of all of our staff is actually a 30-hour contract. And in the 2 London boroughs, they're 24-hour contracts on average. So people have the opportunity to apply for a 36, but the majority don't want it.
No.
So, which is quite interesting. But yeah, and I don't think, I mean, we do have quite a few benefits where I work, but historically, I've worked for small organisations and there's been hardly any benefits at all. But you still manage to retain people because I think you then have to get a lot more personal with your team because you need to retain them. There's that more of that person touch. So I think there are elements of truth in it, but I do think that if you're not doing all of those things and you're thinking, oh my God, I'm not doing those things, actually, I don't know whether, like qualifications, I don't actually, like you said, I don't actually know whether you could do something a lot more personal. And I think when I go back to the care home that I managed, kind of obviously pre-COVID times, if people didn't want to do a qualification in care, they were given the money to do something they wanted to do. And a lot of the time it was like a course in like floristry or driving lessons or something else, which actually retained people for a lot longer than us saying, well, you've got to do your level 2, you've got to do your level 3 or whatever it was.
I also don't, I still don't get to this day the idea of trying to make social care academic. Like, I don't get it. I've done my qualifications. Great. Can I tell you what I learned in them? Not at all. Not a Scooby. If you ask me what I did in what module in my different levels, I wouldn't be able to tell you a Scooby. I didn't really learn much from them. I've learned more working in the sector. I've learned more working with my peers. I've learned more by self-teaching. I've learned more by keeping my knowledge up to date than I ever did in any diploma in social care. And that's what I think we always forget about social care is it's vocational. It is a job where you learn every single day, no matter what you're doing. I learn every single week when we come on this podcast. I probably learned more from this podcast than I ever have done in the qualifications that I've done. Now, I'm not saying mandatory training is not essential and not important. It totally is. And we all learn from that and we need to do it for our roles. But again, I don't understand this idea of using qualifications to sell a role because it also puts a ton of people off in coming into the sector who aren't academic, who don't have the skills potentially required. I mean, you must do your math and English before you do this, and this. Right, okay, but you're just going to scare a ton of people off. I don't know. I just don't think we're getting it right. I don't think we're getting it right.
I laugh because I remember when I had to do my maths for my level 3, I remember doing a management qualification at the same time as a health and social care. Both tutors knew and were like, if this ever gets found out, you'll lose funding for both. And we'll just have to make sure they end a very different time. But I remember the maths test and I had to do it twice because obviously it was on both of them. I remember saying to the tutors, both of them, I've done this maths test about. I am not going to like somebody is going to have to help me. No, man, I'm never going to get it. But I do remember thinking, if I've got to do this, like if this is that qualification or a job, like unless somebody helps me, I'll cheat here. Like I am not getting anywhere like with this. But It's a lot of pressure. And even the English one is a lot harder. I didn't have to do the English, but when I speak to some of the staff that are doing their level 3s now and look at the English, it's a lot harder than it ever was back in the day.
Yeah. And it can't just be pay either. It literally can't just be pay, because everyone who goes, oh, it's because of the pay, it's because of the pay. Like, I see so many national living wage jobs advertised out there. In fact, I see so many, the majority of social care providers now will most likely pay national living wage no matter what the age is. Most people actually just pay national living wage now for anyone working in social care. So
Can
if
I
you're
just
under,
say, it is definitely not the pay, because the amount of people that have come to us from the London boroughs where they're being paid less than the minimum wage is shocking, and they're working there. So it's definitely not the pay.
no, it's not. And the amount of people, I don't see Morrison's having this issue. I don't see the corner shop down my road having this issue. I don't see any of that. It's hours. I feel like a lot of it is, it's the demand, it's the hours, it's the expectations, it's what people don't like talking about. It's really frigging hard. Like, it's really hard. It is not cups of teas and playing dominoes like the advertise in the press and in the government recruitment campaigns. It is emotionally, physically, mentally hard. It's not an easy job to do, and yet we need more people than any other industry. It's ridiculous. It's ridiculous how many people we're needing to man social care. I guess the other thing that doesn't help, it's like, if we didn't work in social care and all we heard was, oh, poor pay, poor conditions, oh, hard job, oh, it's rubbish, oh, it's all overseas workers, oh, you're not going to enjoy it, oh, blah 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 blah. I wouldn't want to go and work in it either. Like, it puts me off. But that's the narrative we put out constantly. The narrative we put out constantly. No one wants to work in social care. Social care is underpaid. Social care is a poor place to work. Environments are terrible. No learning, no education, no career growth, no this, no that, no this, no that. No one's going to, in their right mind, think, oh, actually, yeah, that sounds like a winner. I'm going there. When actually, that's furthest from the truth. There's so much career progression. There's so much that you can do within the role. We're needing more people who want to climb the ladder and do as much as they can do. We're losing managers left, right, and center and not replacing them fast enough because no one wants to take on the manager's role. Because then, yet again, huge issues and huge concerns around how managers are being tracked. You know, you look at Ofsted and that sad, heartbreaking incidents of that head teacher. And yet I've heard the same's happened in social care, but nothing's really being done about it. And it's like, well, hang about. If we're not going to respect our managers, then why would we have managers? But then if we're not actually telling people you can progress to be a manager, we're not going to get managers. But people aren't going to come into the sector because we're telling them how rubbish it is every other day in the bloody press and in all of our campaigns. And yeah, you can put a campaign up that says, come and work in social care. Every day is a joy and every day is different. That's also not the case. Let's not lie to them. We have to be honest about what this is. And what this is making sure people live dignified lives. It's not easy. It's not fun at times. It's not pretty at times. But what you do go home with is a heart full of joy after realizing what you've done for that day is provide somebody some dignity that they can't do for themselves. That's the biggest thing in social care is dignity. And we don't drive that home hard enough. And it's all about have a cup of tea, make friends. Not the case. And I'm not going to lie. I can't sit here and lie. I've been in social care for like 20 years now or something stupid. I can't lie and say that is the case because it's not. Yeah, you're going to have great days and you're going to have really fun days. And there's going to be parts of the days which are amazing. But there's going to be a lot of those days where it's like you want to sit in a corner and cry because of what you're seeing. And there's nothing you can do about it. It's heartbreaking. And we need people to understand that, because when you actually understand what you're doing is changing lives, not to sit down and play dominoes, but actually, like, oh, someone always says to me, like, you know, oh God, I could never do social care. It's just wiping bums. I could never wipe somebody's bum. And I go, right, I get it. Like, I understand. And I understand why it might gross you out. The way I look at it is that person can't do it themselves. Like, they cannot do it themselves. And the thought of them sat in their own incontinence breaks my heart because they can't do it themselves. I'm going to put my pride aside and I'm going to put that childness aside where I'm like, oh, gross. And I'm going to realize that actually what I'm doing right now for that person is something that probably means more to them than all the riches in the world, because you're providing them with a level of dignity that they have lost. And that for me is the big important pull. For me, it's around making sure that people live those fabulous, fabulous moments. And when they don't have those fabulous moments, they're supported in a really kind way to make sure that those awful moments are just a little less awful. And that's the mindset we need, but people just don't want to do it. People don't get it. I'm going on a rant here, and we've only done the state of care report, but it just winds me up.
It's okay. So that is all good. We have had a comment, and then we'll move on to the next report. Qualifications are really important in the sense that you learn what has already been done in a wider perspective. Work experience feeds into this.
I get it. I do. I'm not poo-pooing qualifications. I'm not. I don't think they're the be all and end all. Like I 100% don't think they're the be all and end all. Like I know there are some people out there who would make amazing carers, like absolutely amazing carers, but would be blocked from certain positions because they don't have a qualification on paper to say that they're amazing and X, Y, and Z. And I don't know. I think the care certificate has a lot to answer for, and I get that because people were like, well, people need to understand the importance of care, etc., etc., etc. But that's what an induction process is for. That's literally what your induction process is for. Your mandatory training and your induction process. The care certificate, I still don't think works. I think is a good tool, but I still don't think works. The funding release for the level 2 qualification was not enough, so we're not going to be able to get everybody on that. I don't know. I feel like we run with a lot of ideas before we can actually walk. By no means am I poo-pooing qualifications at all. I can't wait to get my team on a ton of qualifications because I've got people coming to me. I do have people coming to me genuinely going, I really want to do this qualification. And I'm like, that's amazing because that's the drive. And I see the drive and I love the drive. I'm that person. So I love seeing that reflected within the team. I just don't agree that that's the be all and end all sometimes of people coming into the sector. And I think a lot of it is, I'm going to be honest, I think a lot of it is poor management. I am going to say it. I think a lot because Mark, you and I are in the managers' chats. We're in the managers' groups. I've spoken to countless managers around the country, some really amazing ones, and some that I sit there and I think I really worry for your workforce. Like if that's your ideals and that's your approach, I really worry for your workforce. And I think a huge amount of turnover will potentially be from poor management. And I think that can't be shied away from. And I think we do need to invest more in good leadership. But then again, does any industry really have good leadership? I don't know.
Yeah,
I just don't think the
probably
state of care reports told me anything I didn't know.
I think with management, it's that soft skill, isn't it? As you increasing your career. Like I was recording a podcast last week, and it was really making me reflect on. Like I was in a management role at 21, and when I was thinking about it, as I was like speaking, I was like, you know what? I had like no, like I didn't even know what a bloody manager really was. Like it was my first job in care. I started when I was 17. I think I was only in a frontline care position for about 3 weeks before I became senior. And then I was only in that for like a year and a bit, and then kind of just jumped up the ladder very quickly into a deputy and then into. I look back and I think, God, it could have gone horribly wrong. I just based it on all the bad experiences I'd seen, which I knew just wanted me to drive to have great staff teams that deliver great outcomes for people to live happy lives. But yeah, it could have been the complete opposite. But yeah, it is worrying. Before we do move us on, I think the next thing, talking of adverts around alcohol, cigarette, the next thing, and I see them everywhere, and they're handed out at like every single gig that I go to, they are given out for free, is those nicotine pouches. They are absolutely everywhere. If they are not the new vape, I'll eat my hat, because I'm telling you, like they're plastered all over shops, in the windows, like, and I swear people just think they're chewing gum, but just chewing pure nicotine. But yes, next report. Do you want to do the next one?
Yeah, I'm thinking we might only have to, depending on how much I open my mouth, might only have time for this. I just realised it's 8:15.
Let's go to the winter priorities then, because we were going to touch on the Providers Unite. I won't be able to share it, but I'll send it to you, Adam, to share into the chat. A summary blog that we've done on it. But yeah, let's go to the winter.
I can't post in the chat. I don't have the function. It's really bizarre.
Well, maybe I've got it. No, I don't have it either. How strange. All right. Well, I'll put it in the link on YouTube and Facebook. I can do that much.
And I would never poo-poo what Providers Unite are doing. I just want to say again, another report. We're going to be drowning in reports if we're not careful, because it's just report after report after report coming from someone who wrote two. Like I wrote two and added to that oversaturation of reports. And mine were really long as well. Anyway, right. So we've got the Adult Social Care Winter Priorities for 2025-2026. Department of Health and Social Care's winter letter issued by Stephen Kinnock MP. He sets out actions to ensure resilience across adult social care during the 2025-26 winter period. Really interesting in this because Health Watch in our area are doing a piece of work around providing care in extreme weather, not necessarily just about winter, but also summer and any other type of extreme weather that we might be getting. We are seeing more and more extreme weather, more and more flood warnings coming out, more and more amber alerts coming out. Mark, comments just come through saying you had a kind and supportive boss, Mark, more than likely. I've had many like that and tried to be a little bit like them. I get
yeah, trust me. When I was 17, 18, there was definitely nothing kind of supportive about that manager. And I think that's just what inspired me to be a good manager. But yeah.
See, mine was poor care. I remember when I first started, because I like you, joined care. Well, I joined care when I was 18. I was manager by 21. And I think my driving force was seeing the poor care by other carers and management do nothing about it in my first ever care job. And I was a bit like, well, this needs to change. That's not what I'm signing on for right now. I'm signing on to have a really good time and change lives, not see poor care go unsupervised. Anyway, social care winter priorities. So he's called for joint up winter planning. So local councils, care providers, and NHS partners must collaborate to prevent avoidable hospital admissions and support timely discharges. Nothing new there, in my opinion. We talk about this every single year, but I do think it's important that as providers we try and do our hardest. Yes, to support the NHS to prevent hospital admissions, but also make lives better for people. No one wants to spend time in hospital. Let's do what we can internally to actually prevent those hospital admissions. We had Care Boodle. Am I getting that right? Is it Care Boodle? We had them on the other week, talking around identifying signs and symptoms of delirium through the Pinch Me assessment and their product that they've got out on the market. And I think that's what we should be doing a lot of, increasing our skills internally, not by doing a qualification, but actually training people on how to do observations effectively and correctly. All of that sort of stuff will benefit us, but also making sure that we've got the workforce, we've got the contingencies in place to prevent these hospital admissions. Talking of continuity, business continuity, he said councils and providers should maintain robust plans for risks such as severe weather, energy disruptions, transport issues, and staff shortages. And you can refer to the adverse weather and health plan for guidance with putting this together. All I would urge providers on this, and I know I'm going through and giving pointers, but make sure your own BCPs are up to scratch. Make sure you've signed up for your emergency power. Make sure you've signed up for your weather alerts. Make sure you've signed up for flood alerts. Make sure you've tested your continuity plan. Make sure you've got generators if you can fit them in. Make sure you've got heaters. Make sure you've calculated how many heaters you're potentially going to need for the winter. Make sure that's in your business plan. Make sure they're all PAT tested. All that sort of stuff is really, really essential. Infection control, so continue IPC measures while balancing visitor access for residents. Come on, guys, it's 2025. We don't really need to ban anyone from visiting nowadays as long as we're protecting people. One of my homes, really, really, really good stuff. They've put together outbreak packs for every type of outbreak that you could potentially think of. I think they've even got one for monkeypox. It's crazy. But inside those packs is their emergency go-to guides of what they need to do, who they need to report it to, what contingencies they put in place, what structure they put in place in the home. So, consider things like that. And it says follow updated ARI guidance for adult social care. ARI. I don't like that when the words have similar sort of phonetics. Adult respiratory infections. I can't see that being updated since 2024. So I'm not entirely sure which it is they're talking about the updated guidance for. But if you go on the government website, there is one there, the ARI guidance for 2024. Vaccinations. So encouraging flu vaccines, which are free for frontline social care workers without employer-led schemes, ensuring COVID vaccines for adults 75 plus, and immunosuppressed individuals, and encourage RSV vaccine for pregnant women, people aged 75 to 79, and those turning 80 after September 24. One thing I would say about vaccinations as well is check your local schemes, check your local ICB. There are a lot more initiatives out there now for managing your own vaccinations internally within your organization. Sign up to those schemes. You'll get much better uptake from your residents and your team if you can do them in-house. So I'd fully recommend that. Then we go into a few things here that don't necessarily directly affect us, but is good to know. So hospital discharge and intermediate care. So reduce hospital occupancy before Christmas, maintain capacity, reduce hospital occupancy before Christmas. I always struggle with that because why is Christmas different? Like, why is Christmas different? We should be reducing hospital occupancy 24/7, 365 days a year. I don't get. Is it because people just don't want to work at Christmas? I don't know. I don't get it. I just think it's really odd, Poor health is for life, not just for Christmas. We've got to sort of manage this effectively all year round. Maintain capacity for intermediate care and use of home-based recovery services where possible. Maybe they just get an influx over the Christmas period. I don't know. Apply refreshed high-impact change models for dementia, delirium, and preventable admissions. We've just discussed delirium. Housing and homelessness. Early intervention for rough sleepers to prevent crisis and reduce emergency demand. Maybe we should just fix society as well while we're at it, because homelessness is a byproduct of the problem with our society, but that's too hard. 185.6 million for rough sleep and prevention and recovery grant available for local interventions. If you are able to volunteer and do stuff for people though who are hard up and without, I fully recommend doing it. There are many schemes out there in which you can donate to. There's many food banks in which you can donate to, soup kitchens in which you can go and volunteer at, even if it's just going around the streets and providing for people. I mean, the amount of times I'm buying meal deals and hot sandwiches and hot pastries and stuff for people in the streets. And I'm not saying that to go, oh, look at you, Adam, you're amazing. But actually, it's just a simple thing to do. And if you're able to, please do. It's just so simple. And we can help, even if we can't contribute to the big thing. Support for unpaid carers, identify carers early and provide respite advice, emotional support and recognition for young carers. We can do that ourselves as well as providers, because we will know people who come into our services are unpaid carers, so we can guide them into that. One thing that I want to explore within our own services is having a sort of unpaid carers cafe in which people who use our services or relatives of people who use our services, people who are important, can come and share stories, and we can provide advice, guidance, maybe get some support networks growing that way. There's stuff we can do as providers to support them. And funding, up to 3.7 billion additional funding for social care authorities in 25 to 26. Councils retain responsibility under the Care Act to shape diverse and sustainable care markets. Mark, thoughts?
Well, obviously I was reading along as you were going through it. I don't know. I feel like a lot of it isn't actually within the grab of social care providers. Okay, you could identify the unpaid carers from the people that you support. You could then link them into the local authority, or you could make the local authority aware of them. Whether anything will happen, given that we're near the end of November, before we get into the new year with the backlog of local authorities, probably not. So then what support can you actually provide to people? Like reducing homelessness, I don't think social care are going to be able to do anything about that. Even if you've got a spare bed, is it safe to be putting homeless people in your bed because the CQC will be knocking on your door tomorrow? I think you're right around the hospital occupancy. We should all be striving to do that. I think intermediate care is an interesting space. I think over the next 12 months, we're going to see that word used a lot more. I think it's kind of the next hot thing. So I do think we should look at intermediate care in depth more than just for winter planning. I think for me, the main one is around practical things for social care. So around business continuity plans, I think is where you should probably focus a lot of your effort. I think if you've got staff that aren't being fully utilised, or you've got spare beds if you're a care home, is look for winter pressure funding and have an idea and approach your ICB or the local authority with that idea and pitch it to them. Because I think they normally leave it till last minute, then they panic and they struggle. So if you've got something, or if you've got a spare room, you could use it as a step down bed for a hospital to assess people, to deliver some reablement care, and then move them back out into their own homes. So I think just have a kind of think about that. But yeah, I think the contingency planning element in there is probably the only tangible, real thing that care providers, managers can really just grab and grasp and do.
I agree, and it's not hard to continuity plan. Like, it's really not hard. It's just the there's just so much to do when we get that. Like, there is so much to do. But this is where support from other providers is your key here. Build a network up of support from other providers around your local area. Talk to other managers within your local area. How are you managing this? What are you going to do in this scenario? Can you be my backup here? We'll be your backup here. Like, can we support on this? Can we support on that? We're not alone out there, and we've got the ability to support each other. So I would just say, sort of really hone in on your networks, test those business continuity plans. Again, like I said, make sure you've got heaters in place, make sure you've got additional blankets in place. Just make sure you've got all that stuff in storage, ready to go, so that when or if something happens, you're sorted. And let's all not forget as well that winter doesn't finish in January. Like, it pretty much really just starts in January. I think winter solstice is like late December, isn't it, or something stupid? It just gets colder and colder now in February and March. So whatever you're planning for now, you're planning for the next yeah, 4.5, 5 months ish before things start to warm up again. So just really, really look at those continuity plans. Work with your team on them. Work with the people who use your services. Have we thought of everything here? Have you got any other ideas? Don't just sit there on your own and try and get it completed, because then no one's going to sort of buy into it. Make sure people are aware of it. Make it digestible. Break it up. Make sure that actually throughout December you've just talking about that winter continuity plan regularly in your team meetings. Don't forget, if this happens, this is what we're going to do. Put together flow charts, cheat sheets. Really drive it home to your team. But I think it's essential, that sort of BCP planning.
I'm going to just try sharing my screen. Not done this before, so who knows when it'll happen. But we do have this as a free resource that went up last week or the week before, just around winter planning. Adam, I can't see the screen, so you'll have to let me know whether this is working, whether you can see it. Which is just a very simple checklist in terms of to prevent an infection, a notes element, an outbreak management section of what you can do, what you can make sure that you've got in place. Again, lots of notes sections on the right-hand side, and then around staffing and suppliers and bits and pieces. So you can download this from our website for free as a kind of a tool to use, just to make sure that you've ticked bits and pieces off as you go. So do head over. And you can find that, let me stop sharing and I'll go back to our website. You can find that in the resources under audits and action plans. So it's called the Winter Planning Checklist. So do go check that out if you just need some prompts.
How much did you say that was?
Oh, it's free, just like everything else.
Just like everything else at the Caring View. Thank you to all of our sponsors. Okay, so I feel like I've been very negative tonight about reports and everything else. And I promise you I don't mean to be. I feel like sometimes, every now and then, we need disruptive voices to be able to go, but have we thought about this? Have we thought about this? I'm trying to do some work up in Lancashire at the moment about reducing racism within social care. And I really want to bring that to the podcast once we've got to a sort of point in which we can do something about it. Because again, everyone's just like, oh, we're too woke, oh, it's too this, oh, it's too that. But actually, I just really, I feel like the kindness is going within society, and I want to keep that kindness. I think we should be driving that kindness. We should reward kindness. We really should reward kindness. It's not about being selfless, and I'm not talking about, oh, they've put on social media that they've donated to this. Oh, look at them just doing it for the likes. Actually, I've gone past that now, and I actually think it's really inspiring watching people share the good work that they're doing, because I think people have forgotten how to do that. I think people have forgotten how to be kind and how to be nice and how to be supportive. And, I give people some money in the streets, and one thing people turn around to me, oh, they're going to go and buy drugs, they're just going to go and buy a drink, they're going to go buy drugs. I'm like, I'm giving them money because they need something. They need support. They need help. What they do with that, unfortunately, I can't take as a guilt, because that's what we've allowed as society. We've not supported them as society. I'll also buy them a blanket, and I'll buy them some food, and I'll buy them some drink. But who am I to say you're less than me, so you're not entitled to money? Because I'm also going to give them money. It's we all make. I don't know. Again, maybe I'm a bit of an idealist. I just this time of year, especially this time of year for Christians, for example, and for other religions, there'll be other times of year. But for me, this time of year is all about community. It's all about supporting each other. It's all about love. It's all about kindness. It's all around forgiveness. And I just don't think we're remembering that too much at the minute. And I would just urge people to, I don't know, give it some thought over the next couple of months. Maybe do some work with your team around what sort of acts of kindness have they done recently, and do some self reflections with people and share that acts of kindness within your team. We just need to do more to promote a kind world at this moment. I
That
feel
we
like I
do.
need
We
Bob
are
Geldof to write me a song now.
no, we are in very strange times as a society. It's bizarre, but I don't think it's just England. Like even when you're just in the comments in general on social media, it's everywhere. Like, social media has a lot to answer for.
I wouldn't know. I'm not on it. Huh? Still get people come up to me going, "Oh, I'm glad you're okay. You've not been on socials for ages." And I'm like, I know that's why I'm okay. It's amazing. Like, I'm good because I'm not on socials. Like, it's the best thing ever. I think I went on Facebook. What did I go on Facebook for the other day? I think Steven doesn't do TikTok, you see. And that's probably the only social I have to watch funny videos. And he sent me a Facebook reel. So I watched this video that he sent me and I chuckled. And I went to close it down and my Facebook popped up and I thought, oh, let's have a quick gander around, see what's going on. I think I had something like 40, 50 friend requests from people that have been waiting like 12 plus months. And I was like, oopsie. And I just logged off and I like didn't even acknowledge it. LinkedIn sends me a message every now and then saying you've got X amount of notifications waiting for you. People are waiting to hear from you. And I'm like, I might go look at it at some point, but you can grab my email, me, you can contact me for the caring view. I don't do socials, and it is so freeing. Like, it is so freeing. It's wonderful. Absolutely wonderful. I urge everyone to give up social media.
I don't have nothing to fill my time with.
You've got nothing to fill your time with. Just before we close down, Peter says they're not too woke. They need to wake up as this may progressively affect them 100%. In fact, ironically, that's the whole meaning of woke, is to be awake to everything that's going on. So it's like, if we're woke, that's fine. I am woken. Like, I am awake. I don't care. And then Trish has come in to say extreme weather. I prompt people to work collaboratively with local hotels, guest houses, etc., in case people need to be evacuated from their place of residence. Great idea, Trish. Although, just putting this out there because this is something that I got from feedback from a BCP. Most contractors, most commissioners now don't accept you putting hotels in as an evacuation place in your nursing homes and residential homes because they're not equipped, which I find really bizarre. And you've got to really try and find other nursing residences if you're a nursing home, or residential residences if you're a residential home, to be able to evacuate to. I'm not saying don't put them in, but just make sure, a bit like when you apply to university or like you're putting your kids to schools, make sure you've got your first and second choices first, and then like an emergency backup just in case. But yeah, totally. Even if you can get your local hotels in the local area to sort of get a collaborative network together and an understanding that if shit goes down, they're there to support. Totally agree. I think it's a great idea, that, Trish. Okay, Mark, do we know what we're doing next week, seeing as CQC screwed us up and changed our entire plan?
No, so we are looking at doing something on the fair pay agreement and breaking that down, but there is nobody that is willing to commit to come on and talking about it in detail. So if there is anybody that knows anybody, please do let us know so we can reach out to them. But yeah, no, if not, watch this space and you shall see.
We will try and get Nicola back, but Every Step Care Consultants is really busy. Like, she's one of the best consultants out there, so she is going to be super busy. So yeah, we will try and get Nicola Holmes back to us. Trish, totally agree. Risk assess it. At the end of the day, you're probably sending a team with them as well. So like, so yeah, I'm not poo-pooing it. It's just it's feedback I've had in the past from other providers or other contractors. So yeah, okay, right. Well, watch the space. I know I say I don't do socials, and I'm hoping you're all on socials, so don't quit social media just yet, because that's where you find out everything about the Carrion View. But do go follow us on socials. You'll find out what the show's about. Better yet, subscribe to us on YouTube, because every time that we schedule a show, you will get notified of that. And let's go old school. Let's go back to YouTube. You know, YouTube's amazing. So subscribe to us on YouTube. You'll get notified of everything. Go to the website, find out all of our free resources. Download that free winter planning guide if you want to prepare for the winter. Trish says pesky CQC. That's not the word I would use, Trish. But yes, I agree. Lol. So yeah, we will be back next Tuesday, 7:30. Oh, potentially we'll be back next Tuesday at 7:30. Mark, I need to have a conversation with you about next Tuesday, because I don't know whether I'm going to be back in time from my trip with work, but we will figure that out, and we will make sure that there's something out there for you. But until then, please do take care, stay safe, plan for the winter, read the state of care report, complete your SWDSs, do the consultation for the CQC, do the consultation for the fair pay agreement, subscribe to us on YouTube, and put up your Christmas trees if you celebrate Christmas. If you don't, that's absolutely fine. Plenty of other holidays around this time of year, Kwanzaa, Hanukkah, loads going on. So yes, we will see you next Tuesday. And don't forget, sorry, one last thing, next year, back to basics. So none of this struggling with, oh, CQC are changing their mind and they're doing this and messing up our shows. No, we're going back to basics next year, bringing you skills direct that you're going to be able to implement within your service and get your team trained. But until then, Mark, you're going to have to end the live this week, because I can't do it from my end. And we will see you at 7:30 next Tuesday.
See you later. Have a good evening.